3, 2.
Hi everybody, Dr. Garrett Wegerif here at Pure Plastic Surgery, here for another Thursday Thoughts. Today we're going to be discussing a topic for another option to restore volume to your breast. And what is that? It's an option where we can use your own tissue, so fat grafting to the breast. We're going to go over who would be an ideal candidate for this, the advantages and the limitations of this, and some additional things to think about if this is something you're interested in doing. So first of all, what are the options we typically have for restoring volume to the breast? Is most commonly an implant. What does an implant do? It offers a very stable structure for us to reliably build off of for restoring volume to the breast. But the disadvantage is it's a foreign object that some people just don't want to have. They don't want to worry about replacing them in the future, and they want an option where they can use their own tissue to achieve the same type of a goal. So implant, great structure, it's very reliable, it's the same size that we put in, it's going to stay the same size. That's the advantage of it. The disadvantage is it is a foreign object. It does need to be replaced at some point in your life or removed altogether. And so the option that we have instead of the implant is doing fat grafting. So we do liposuction to a different area of your body that you want to improve the contour of, often the abdomen, flanks, back, and we can use that fat to graft into the breast, very similar to what we do for a Brazilian butt lift or a BBL, where we're grafting fat into the butt. And so the advantage of this is we're using your own tissue. It is going to stay there, and it's you're not going to have issues with needing to replace it or anything like that. But one of the limitations of it is you need to be the right candidate for this. So let's talk about that. First of all, you need to be someone that...
Okay, we're going live everywhere.
Okay. You need to be... There's feedback coming from...
Yes, let's.
You can't have ptosis or a significant amount of sagging of the breast. You can, but we would need to do a breast lift first and then come back later to do the fat grafting. So really, who's an ideal candidate for this is someone who's lost volume to their breast, potentially someone who's had a child or had some weight loss and had deflation of their breast. In the fat grafting, we're going to restore that volume. You're never going to quite get the upper pole fullness that an implant will give you, but we'll be able to restore that volume and give you a nice appearing breast. You also need to have donor fat. So if you're super skinny and you don't have much donor fat, you're probably not a great candidate for fat grafting to the breast. One of the other things is fat grafting to the breast, the take of the fat or the long-term survival of the fat is a little bit lower than it is for other parts of our body. So for our butt, we usually say between 70 and 80% of the fat that we transfer is going to survive long-term. For the breast, it's only about 50 to 60% is going to survive long-term. So this may mean that we'll need to do more than one session of fat grafting to get the ultimate result that you want. Sometimes that's 2, sometimes that's 3. And how much can we transfer at any one time? It's typically about 250 to 300 cc's, and of that we expect 60 to 50% of it to last long, or to take for long-term survival. But that just means we can do liposuction first on your abdomen, then on your flanks, or in your inner thighs. So in addition to getting the fat grafting to the breast, we're improving different parts of your body that you would like liposuction on. One of the additional things you have to think about whenever we transfer fat to the breast, it can change some of the radiographic findings on the breast when you're getting your routine screening for mammogram. The literature shows that most patients that have any change in the mammograms, it's easily identified by an experienced radiologist as possibly fat necrosis. It can show some calcification, some different things, but they're typically able to show that it's a non-cancer appearing area, but it may slightly increase your risk of getting biopsies to rule out cancerous lesions. Even though it doesn't cause any cancer, it just may change the imaging that you'll see. But it really is a good option for patients that want to use their own tissue. They don't like the idea of an implant, and they're interested in getting liposuction in different parts of their body because we're able to do both of those at the same time. Just be prepared for possibly more than one round of this to get the best result that you want. Do we have any questions about fat grafting to the breast?
Okay, had a breast lift and augmentation at my 22s. No, in 2022, my implants are all side boob.
Mm-hmm.
So what she can do?
So there's a few options depending if it's truly just an issue with the implant migrating to the side and you want to keep those, well, we would exchange the implants, but you want to keep implants, we can tighten up the pocket. That's called a capsulorrhaphy. Means when I go inside, I remove the implant, I can see inside the capsule. I can tighten up the capsule with electrocautery and also with sutures to bring things back to the middle. If you also have sagging of the breast, like the skin or the nipple position isn't ideal, we would probably also recommend doing a mastopexy or a breast lift at the same time to address both of those issues at the time of the implant exchange. But it's definitely something we can address.
Okay. What can one do if you are not a candidate for a tummy tuck, but your skin isn't tight?
Well, I would want to talk to you to understand why you don't think you're a candidate for a tummy tuck. But if loose skin is your main problem, a tummy tuck or some type of skin removal procedure is the best option to improve that. We do have some other modalities in addition to liposuction that can help with skin tightening, and that's including Vaser or BodyTite, which are both energy devices that help shrink down the skin. But you really need to be examined before we offer you those options to see the amount of skin laxity you have. If you actually have hanging skin where it hangs over, that's not going to be sufficient. We really need to do a procedure to remove that extra skin.
I got implants in 2022. This is the other
Okay.
part, and not what I wanted. Got it done with someone else.
Yes.
Could you fix it?
Yes, we can fix it, and we often are, doing work on people that have previously had operations done with a different surgeon.
Okay, there is another question drop here. Could be possible doing a BBL? I guess that fat transfer
Fat
into the
transfer.
breast.
Yeah, it is possible. We could do that at the same time. Well, actually, that would be tough because of the same issue with your BBL. You don't want to be sitting on the grafted fat because it needs to establish a new blood supply. We also would not want to compress the breast. So during that recovery process from the BBL, you're supposed to be sleeping on your stomach. That's going to be putting pressure on the breast. It's possible we could talk about that by padding with pillows, but I don't think that's the most ideal situation to do fat grafting to both areas at the same time. We should choose one to focus on at a time.
Okay, this is here on Instagram. Downtime for fat grafting to the breast.
It's really not that bad. It's similar to our liposuction procedures. And so liposuction, you typically have pain that limits you from going to work for maybe a week, depending on what you do. And, 4 to 6 weeks to get near the final results, even though those continue to improve over time for the next few months. But your downtime from work would only be a week or two.
Okay, done.
All right, everybody. Thank you so much for tuning in. I look forward to seeing you next week.